tell us as much as possible, like, what do we need to know about this?
It's going to be a really informative, really in-depth educational platform.
You are massively failing mothers because their expectations are not meeting up to what reality is.
It was really awful because they tied my hands to the bed. I don't know if that still happens. I have no intel.
Tell us about mother.
I do love that question. Okay, mother. So, as you know, I co-founded a different business prior to Mother, and I was there for 9 years. I built a lot of it. All the ideas were really organic, and it just really came to me. But there was something about it that just didn't feel like me. And I stepped away from something that I had built for 9 years. All I know is I still want to continue this journey. I want it to be to support mothers within my own field as a midwife, but what's it going to be? I always come back and ask myself, where does my passion come from? Like, who inspires me the most? All roads led back to my own mother. Then all future roads lead to mothers. So it was like a no-brainer that I thought, oh my God, it has to be Mother. It has to be Mother. It has to have Mother in the name. It's going to be a really informative, really in-depth educational platform where women can just tap in and out of it as and when they need. It's not, and I know everyone says this, but it's different. It's not your typical, but it really isn't your typical one. Because everything that I'm doing is with the system in mind. What I wanted it to be was not just your average antenatal class.
Yeah.
It was always going to be, right, here's what you need to know about labour and birth, but the thing you think you need to know about is not necessarily the pain relief or the science behind it or, you know, or the theory that maybe somebody would learn at uni doing a midwifery degree. What you need to learn is about how to navigate the system, because it's a system that's going to fail you. It's when people aren't getting the experience that they want, it's not because they didn't know what a contraction was. You know, you don't even need to know what a contraction is and you still make it through labour. That doesn't decide whether you'll have a positive birth or a negative birth. The deciding factor is how the system treats you that day.
The antenatal classes that exist for breastfeeding to prepare women, literally like the 6 different breastfeeding positions, a picture of what a latch should look like, which, by the way, if you really deep dive into that picture, it's a poor latch. It's a really poor latch. So these women are thinking like, okay, I'm going to go into this journey. I did a 3-hour intensive course. Like, I know the 6 different positions. I've got this. And then as soon as their baby's born...
No, it's completely different.
As much as we want to keep encouraging women to prepare antenatally for breastfeeding, women just can't see past that labour and birth.
But do you blame them? Because and I agree with you entirely, they can't see past the labour and birth because that's what the media, that's what their pregnancy, their care providers have focused on. Everything is about your risk pathway to labour and birth. This for labour and birth. This is what everyone outside of women, because how are women meant to know? Everyone outside of women, unless they've had a baby before, and if they've had a baby before, if anyone watching has had a baby before, they will know it wasn't about the fucking, sorry. I don't know.
It's fine. It's
all right,
fine.
okay. They will know it wasn't about the fucking labour and the birth. It was about, this time I want to focus on the postnatal journey.
Yep.
Because it's the postnatal bit. You will prep 9 months or however many months for a labour and a birth that will happen one way or another.
Yep.
It's going to have to happen one way or another, whether it goes to plan or it doesn't. But the next 18 years after that, which I can only account for the 28 days after, the rest of that, I'm sorry, I have no guidebook on that whatsoever. I don't think anybody does.
As soon as that baby is born, what are they going to want to do? What are you instinctively going to want to do? Feed them.
Yeah.
So why would you not want to prepare? And I think it's important to say that not why would you not want to, because you probably have done a 3-hour intensive antenatal course thinking that you have been prepared, but you are so far from having had been prepared, especially because women even now are given so much misinformation. I was speaking to a mum a couple of weeks ago and she said that she'd done a private breastfeeding antenatal course, and I wanted to just kind of like check her knowledge, like find out like how prepared she actually is. So I said, talk to me about day 1 and day 2. So she said, right, I know that on day 1 and day 2 you feed your baby every 3 hours. So I was like, okay, let's write that down as a question and we'll come back to that at the end of our session. So we went through the entire session and we went back to the question and I go, right, so what is the answer to this question? What do we expect
now
from feeding?
based on what you know?
Yeah. What do you expect from feeding on day 1 and day 2? she just crossed out that every 3 hours, and she was like, baby will feed as often as baby needs to feed. Because if women have this expectation that their baby's going to feed every 3 hours and then they're going to sleep contently in between, like, you are massively failing mothers, because their expectations are not meeting up to what reality is.
I think this is the biggest issue that I have, or that I witness, when it comes to being a community midwife and then with breastfeeding. Because women aren't told enough, and Lord knows I try, and I know we all try. But we need everyone to sing from the same hymn sheet, because women are not told enough that it is normal when you are breastfeeding. There is no set routine. Because if you then don't tell a woman that, and a woman then has a baby, and this baby comes out and it's now feeding, and then is now feeding every hour and a half. And then you come in as the community midwife, and the woman then says to you, I had to give some formula because the baby was hungry. Or the midwife on the ward said, your baby is screaming because they are hungry. That is my pet peeve. Yeah. That is my community midwife pet fucking peeve. Your baby, I'm not saying that your baby wouldn't be hungry. There are signs. You have to look at this baby as a whole. Then you need to assess the entire picture here. It's not just about a crying, screaming baby. You have to know about the urine output, how many poos, the wet and dirty nappies. You need to know about the baby's behaviour as a whole after the feed. How is the latch? Because if you're telling me that, it's a really bad latch, it's so painful, wheeze and poos have slowed down, baby's really jaundiced, and baby's screaming all the way in between. Yeah, okay, you know what? You're probably right. Your baby's probably hungry. But giving formula isn't the thing that's going to solve that. Giving formula is going to settle their stomach, so they'll stop the crying, but at the next feed, then what are you going to do? Yeah. Because now you're in a cycle of wanting to give formula, and if that's your choice, there's nothing wrong with that. But if your choice was to, or your dream was to breastfeed, then we're doing you a disservice by saying, baby's hungry, give it some formula. At that point, there are so many things that we could do to stop you from having to give that top up if we had corrected the latch, the positioning, referred you to a specialist. Like, there's so many things we could. Treating the jaundice is one of them. You've got a very drowsy baby, that baby's going to find it really difficult to feed. They're not going to have enough energy to feed. And I think if women knew this, they would give themselves way more grace when it comes to their breastfeeding journey and wouldn't jump to a solution straight away.
I think that one of the biggest things is because they have a certain expectation, they literally think on that day 1, day 2, day 3, they think something's wrong with my baby. Something's wrong with my body.
Exactly.
So all of a sudden,
I didn't produce enough. I tried, but I didn't produce enough.
You know what's really, really hard about that is, and I hear this so often, in that moment in time, I can't say to the mum, that's not true. Right. Because that's her narrative. Like, that's what she has made peace with. Yeah. So you can't.
And also, you don't know. It's true. Maybe you didn't produce enough, but were you given the support to explore that, to really come to that conclusion?
One thing I will say is that if you have a baby, in those first couple of days, they're making those wet and dirty nappies. You're seeing that stool transition. Yeah. A baby who is crying is a baby who has enough energy to cry. Yeah. And that is so, so important. Yeah. Because if your baby, because we know that day 2 and day 3, that newborn frustration, that feeding on and off, has not been normalized. So you think my baby is starving, but actually your baby's just working really, really hard to bring your milk in. I would be worried if your baby was actually sleeping for 3 hours. Yeah. That's my concern.
Yeah. I think we always get taught all the time when it comes to like study days and stuff, and it's always a line that stuck with me even when I was a student, and they always said formula brands sell sleep to sleep-deprived parents. And I think it's such a good way to view it, because it's so true. And this is no dig whatsoever to anybody who chooses to formula feed. If that is your choice, that is a perfectly fine choice, no matter what your reasons. But if you turn to formula because you feel that that was your only way, because you felt that, well, I didn't get the support or I couldn't breastfeed, and you're putting that blame on yourself, but really, was formula the answer there? And that's not for you to have decided. That was for you to have received that support, and that was unfortunate that maybe if this resonates with you, that you didn't receive that when you were owed it and you deserved it. But I think that why so many, not all, but so many do turn to formula is because they are exhausted. Yeah. Parents are exhausted, mums are shattered, and they've just gone through all of that with their body, and now they're expected to recover and to heal. And when you see a mum, you realise so much of it, even without them wanting to, even with all the help in the world, so much of it is on their shoulders, even if it's just mentally. And I think that when that happens, you are then looking for a desperate out. And you're thinking, okay, well, it's not good enough what I'm doing, so he's obviously hungry, I need to give him something. And so you turn to the formula, and what does the formula do? It makes them sleep very well.
Yeah.
And they settle so nicely afterwards. And then you don't have a screaming baby for about maybe 3 hours, maybe even 4.
Yeah.
So what has that marketing done for you? That they've marketed the formula as like, you know, second to best at breastfeeding and blah-de-blah-de-blah, but your experience now is that formula came and saved the day.
Yeah.
When actually that wasn't the thing that was going to save the day. It was a great interim, but was it needed? No. But because your baby slept now you're thinking whatever you had to offer was less than, that it wasn't enough, when really it was. You needed somebody to reaffirm that for you.
Because women don't expect how frequent the feeding is in the early days,
it throws them. Then
what happens is, if they do get to that kind of breaking point where they're like, I just need some respite, they give formula, they see that, okay, yeah, it's almost acted like a drug, and it's just put that baby to sleep. But they think, oh my God, but once my baby wakes up, I'm going to have to keep doing this. And they can't see past that stage.
It's hard to get out of the cycle.
So they think this is what their breastfeeding journey is going to look like forever.
Yeah.
But it's only for a couple of days. Then once the milk comes in, the feed starts...
They
start getting more spaced out and things naturally settle. But I can say this, when I was a first-time mum, every phase and every moment felt never ending. Because you just couldn't see past that. And then when it comes to the second, you're like, oh, like this...
Oh,
it's
please.
not going to be like, just get on with it.
True. And the most common question I get asked all the time, I will walk into women's homes and they will look at me with this like, please help me, and I'm looking at them and I'm dying on the inside because I'm thinking, you guys have no idea, this is going to pass, like tomorrow will be a brand new day, it will be fine. And they'll say, okay, and how long is it? It's always the men as well, it's always the partners that end up saying like this, okay, and they're just sat there and they're listening, and the mum is really like, she's understanding the biology and the theory and everything behind it, and the man turns around and he says to me, okay, and how long is this going to last? You're like, don't worry, babe, you're going to work in 2 weeks, relax. No, but it's hilarious. It really is, all jokes aside. It is so funny because we're standing on the outside and we know it's going to get better.
Mums need that.
They need that.
They need someone on the outside who is specialised in whatever topic you need support in, to be your cheerleader, be your guiding support, uplift you, help you navigate.
And just be that voice of reason to be like, hey, this... And it's not good enough to say this is normal. Normal? Why is it normal? Brother, tell me why it's normal. Because that's not going to settle me. You need, now explain the science behind it. Because if I then say to you, this is growth spurt behaviour, your baby was up all night wanting to feed and be held, wasn't happy being put down, because it was the only way to teach your breast, to stimulate it, teach your breast to make more milk for the next day.
Yeah.
When I explain it to you like that, then you're like, oh, now that makes sense. So now you're so much more accepting of that behaviour, even if it's driving you insane. Whereas if you just say, oh, it's normal, then you're just sat there like, surely it can't be, because this didn't happen to number fucking 45 down the road. You know, their baby was not crying like this, and somehow at that point, it's so funny because you'll have house parties, you'll never think about your neighbours once, but when you have a baby screaming, you're like, the neighbours are going to hate us. Like, bro, they hated you anyway. From that Christmas party you had like 3 years ago. No, but all jokes aside, genuinely, when you explain something to somebody, we are not stupid. People aren't stupid. They understand. So speak to them how you would want someone to speak to your own mother.
You know what's funny is that when I come in and I'm supporting mums and babies, so last week I had this dad say to me, he was like, you know, I really like the way that you're speaking to our baby. You're speaking to our baby like they're an adult. And I was like, yeah, because, you know, we're on a level, like, he gets me, I get it, like, it's, because the thing is, I think...
Wait, you were speaking to the newborn, like an adult?
Wow. No, and they just listen, So when I was, like, checking, like, oral function checking, one of the things I do is I get them to bite down with their gums on either side. So I'll put my finger in and I'll be like, can you bite down, please? And they'll do, like, a little bit or something, and I'll be like, can you try a little bit harder? they'll bite down.
Cute!
And then I do the other side, and I just feel like they get you.
They
Like, they're
respond.
so smart.
They are.
So smart.
No, they're smart.
Whenever I'm doing something, if I'm doing a check or whatever it is, if they like move their hand to like move my hand, like I know that that's purposeful. Like, they're so clever. Or if they make a sound or something, then I'll be like, okay, hands off. Like, let me give you a moment to just rest, relax, and then we start again. And then I'll actually ask permission. I'll be like, okay, can we start again now?
Yeah.
They know so much.
That's so nice. I definitely speak to them like they're babies. I do. Maybe I should. But I don't do the things that you do also. I don't do like oral function tests and things like that. I'm not having to put my hand in their mouth and stuff at home visits and things like that. And so I don't need to do anything invasive in that way. But actually, no, that's a lie, because I do the heel prick test and I don't speak to them like an adult. I definitely speak to them like a newborn now. I'm so sorry, my angel.
Oh, no, but I think mums need that in that moment. It's very different. Essentially drawing blood. Like,
Yeah.
Yeah.
I'm like, I'm so sorry, baby. And they don't have a name, so I can't even call them by their name. Oh.
Funnily enough, like, since we've been posting stuff on Instagram and people have seen that we've got a connection, I've had a lot of either family members or old clients that will message me and be like, I know Leela, she was my midwife for X, Y, and Z. Yeah. And they all have the same resounding thing, that you took the time to actually like explain and support, which I've not heard anyone talk about any other midwife the same way. The thing is, right, is that the system is not teaching it correctly. So for the most part, the people who are coming in and doing like nipple to nose and burger your boob and forcing and all the rest of it.
Yeah.
So what happens is you have mums who have been taught all of that in the hospital, then go home, then midwife or health visitor teaches them the same thing, it's still not working, then they go to a NHS infant feeding clinic, whatever, children's centre, being taught the same shit.
On repeat. I remember I was a student when I was doing my final year. I was literally a month away from graduating. And they were drumming this into us. Nipple to nose, nipple to nose, nipple to nose, big wide mouth, blah, blah, blah. I was making up a lot of my hours on the postnatal ward, so I had a lot of exposure there. And there was this woman that she was just like, she grabbed the baby, she put it with her elbow, she latched this kid on with her elbow, and it's all the things that we say not to do. It's all the things that we've been taught to tell women not to do, and it worked for her. And I could see that baby was on the nipple, Annika. Like, that baby was like that nipple was just, you could see it. And I'm looking at her like, does this hurt? And she went, no. I said, do you feel it? No. She was comfortable as anything. And then I realised it's not one size fits all. It's a great place to start if you're trying to teach somebody something. But if that's not working, you cannot keep saying the same thing to someone, teaching them the same technique when it has been proven not to work on this woman. Because everyone's body, breast, nipple, baby is going to be different. So that's where I think that with the information that we share, I agree. The information that we have on the NHS is limited. What we are trained to know when it comes to feeding is limited, and we rely on updates once a year, unless a midwife goes out and does her own, self-learning. But we have brilliant midwives. We have some bloody great midwives who work on our wards and who work within our system, and you think, those are the people that you kind of look at and you think, God, whoever gets her today is so lucky.
Yeah.
But when somebody is constantly drumming in your ear, nipple to nose, nipple to nose, nipple to nose, and nipple to nose is not fucking working, change it up, Yeah. That's when we need to know what are the alternatives. And it's okay for us not to know it. We don't need to know everything, but we then need to know when and where to refer to.
Yeah.
And that's where we then let women down.
Yeah.
The women are not side-eyeing you because you are the midwife who didn't know. She's side-eyeing you because you said, well, there's nothing more we can do, why don't you just give a bottle?
Yeah.
When there was lots more we could have done.
I really, really wish that you had been my midwife when I had my first baby. And the reason why is because as a first-time mum, you are a little bit naive, and I think you hold the healthcare system on like a pedestal, and you think that whatever they say is the right thing, they're doing it in your best benefit.
Facts.
So I fell pregnant, and they say that, you can have an implantation bleed. So I bled during my first trimester.
The whole trimester?
Yeah. And into my second, but I just kept thinking implantation bleed. Like, I just didn't think anything of it. Naivety on my part.
Yeah.
when I had first flagged it up to them, they had also said implantation bleed.
Right.
But then because it continued into my second trimester, at that point they were like, I mentioned it again in passing, and they're like, oh, that doesn't sound right. Let's...
Was everything okay?
Yes.
Subchorionic hematoma?
Yes. So where the placenta had attached to the wall, there was a bit of a bleed. But, so it was old
kept
blood
coming
that
away.
kept... Yeah.
Yeah.
Throughout my entire pregnancy, I was severely depressed. I would cry.
This is your first pregnancy?
Yeah. I would cry every single day in the shower after I came home from work.
No.
And when I did flag it up to the midwives, they said that it's normal, it's just my hormones.
It's normal to cry every single day in the shower after work?
Yeah.
I don't think so.
So then, obviously, that happened and I was just like, you just kind of feel a bit dismissed.
Yeah, of course you do.
Yeah.
And then you think, well, maybe you're overthinking it in your head, so you are the problem. When actually that's not normal.
Yeah.
It's okay to cry every now and again and like to just feel a bit down in the dumps a little bit. Or just feel a bit emotionally a bit heavy or whatever every now and again. Even once or twice a week, fine. Every day in the shower after work.
Yeah. I felt so resentful being pregnant because I struggled so much.
Resentful to who?
To the pregnancy.
So interesting.
And I can say that openly now, but it's such a shameful thing to say because...
It's not shameful at all. I don't think it's shameful at all. And I think when we sit and we tell ourselves that there is a certain dialogue we should be having with ourselves in pregnancy, we are doing nothing but a disservice to women. Because what we have done as a society, globally, is we have said from young, pregnancy is the best thing you'll ever go through. You are glowing. You look amazing. You look this. There is no in between. There's nobody who just looks normal. Oh, you haven't changed. There is either, from what we've heard growing up, it was always, and I'm talking about like through people, society, movies, whatever, it's either you are glowing or you look like shit.
Yeah.
Like, oh mate, you look like you, is everything okay? Or, wow, it suits you so much, but there's nobody that will say, she's just my fucking friend, she's just pregnant. Like, she hasn't changed. She's exactly who she always was. And I think that there's this massive transitional period where you are finding yourself all over again. And that's only if you fucking found yourself to begin with. Because how many of us have actually found ourselves anyway?
Yeah.
With this whole soul-searching thing that we're all now talking about. And it's like, everyone's on some spiritual journey because we think that we're going to be healthier for it. And maybe that's the cause of all of our stress. And now we're taking ashwagandha and all this shit. Which I take. I don't need to tell anybody, if you've had a child before, your baby comes and that's it. You are right there, like in the background. Everyone, all the attention is now the kids.
But also for you, your world now revolves around this baby.
Yeah, of course.
But like, and you want it to, but then
you grow resentment to it.
Yeah.
Yeah, of course you do.
Yeah.
Because you've known yourself for 30 odd years, 20 odd years, 40 odd years, however old you are when you have your baby or babies. And it's almost like now you need to get to know a new version of you. And not just you. You now need to get to know a new version of you, your partner, your relationship as a whole, your home, because that changes.
Yeah.
The food that you eat, the places that you now go and socialise, the friends that you have. And so when you say that you grew resentment towards the pregnancy, I've said this before, and I'm going to say it again. We don't need to sit and tell the world how grateful we are that we are pregnant. We know. That is by default. So we know you're grateful for the pregnancy. And we know that you are grateful that, and you know that there are some people who can't, and you're so lucky and, healthy and whatever. Doesn't mean you can't have a shit time.
Yeah.
And when we sit there and we tell people, oh, but you should be really grateful. How about you fuck yourself? Because I'm also allowed to just feel really shit.
Yeah.
And I'm also allowed to acknowledge that my body is under a lot of pressure. It's working really hard. I'm swollen. I'm peeing 24/7.
Yeah.
I feel sick all the time, which should not be underestimated. That is a horrible, horrible symptom. It is debilitating. And emotionally and everything around you, everything's changing. So when you say that you grew resentment to the pregnancy and it's a shameful thing to say, it's not shameful. And the most shameful thing that we can do is shame a woman for thinking that. Because then If she doesn't say that out loud, how do we know what support to give her? And when we don't allow women to speak their truth, all we're doing is belittling them.
And I think another really shitty situation that a lot of women are in is that we have this comparison. So when I was pregnant, I didn't have morning sickness in the sense that I would not throw up.
Yeah.
I was just nauseous all the time.
It's the worst. At least when you throw up, you've got a relief.
Yeah. But what would happen is I had family members who would compare me to their daughters, and they would be like, oh, well, at least it's not as bad as what they went through, you know, at least you're not throwing up. And it's like, that really belittles how you feel, but it also makes you feel like I can't feel shit because someone else had it worse.
Yeah.
And I ended up experiencing that a lot during my pregnancy with little things. It was like, oh, but at least you're lucky for this, and at least you can do this. And it was just like, that's taking away from my feelings.
And it's no different to somebody who then experiences a pregnancy loss, and then you say, well, at least you can try again. And you think, well, how helpful was that in that moment there?
Yeah.
What did that solve?
Yeah.
You know?
Yeah.
It didn't take my pain away. It didn't stop me from crying. I didn't just sit there and go, why didn't I think of that? Dickhead.
Yeah.
Do you know what I mean?
Yeah.
And so actually, when you invalidate somebody's symptoms, you're just being a dick.
Yeah. We went through with obviously finding out that the hematoma thing. And then at that point, they flagged up that I had a low-lying placenta. I think I had additional scans because they wanted to keep an eye on the bleeding thereafter. Yeah. All I know is that they said, we'll wait for the placenta to move up. We'll wait for the placenta to move up. Did it move up? No, it fucking didn't. So they were like, if it moves up by 20 millimeters, so there was like a minimum that it needs to be away from the cervix, then no problems, you can have a vaginal birth, blah, blah, blah. So, and I did, I wanted a vaginal birth, and it got to that point. It was literally smack bang on that. But they found that baby was breech, frank breech. So frank breech is head, bum, legs. So her head and her legs are really jamming up my diaphragm. Yeah. And they were like, but no worries, well, what are your thoughts on an ECV? The senior consultant checked everything over. He checked my pain thresholds as well to make sure I could handle it. And he was like, yeah, you're completely fine. Let's book you in for that. So I'm probably like in my third trimester by this point. Yeah. And an
ECV is when you try to manually turn the baby the right way around. Basically, it's only a procedure that a doctor does. Most cases that I've seen, if not all of them that I've seen, I've only ever seen it once be done in a labour ward room, and one of the doctors was like, that needs to be done in theatre. So I think it just depends on the position of the baby and how easy they think it's going to be, but it needs to be done under a controlled environment, usually in theatre, usually with a spinal in situ, because if the baby responds negatively to it in that the heartbeat drops, because the baby's being monitored the whole way, there's a scan going, they can see where they're turning baby and how, etc. And if the baby responds negatively to it at any point, they need to be able to do the crash section there and then. I
went in, all booked in for the ECV. They gave me the drug to relax the muscles. So I'm there like laughing away, my belly's jiggling. I still got the videos. 2 hours went by. Doctor's not ready yet. Consultant came in, not the senior consultant that gave me the green flag. This random guy who had been like, whatever, he got caught up in some other surgery or whatever, fine, fair enough. And he took one look at my chart and he said, how many weeks are you? So I think I said I was like maybe like 36 weeks at that point, maybe. Mm-hmm. And he goes, okay, we're not going to do this. We're going to book you in for a C-section. And he just walked out.
What?
Yeah. And I was mad. I was so mad. And I was like, you've given me this drug. I'm shaking like anything. You've made me wait 2 hours. And he didn't even attempt it. He did not even attempt it. Like, I was so upset.
I'm sure.
And I complained to the nurse and I was like, this isn't fair. Like, why would he give you the green light to give me the drug to only say he's not going to do it? That doesn't make sense to me. Don't give someone a drug without even meeting the patient and having an assessment.
The thing is, you've also psyched yourself up for this procedure, whether you wanted it or not, and you've really got yourself like, okay, we're going to do this and this is what's going to happen, and you've built this story in your head, so when it doesn't happen, it's almost like a I didn't want it to begin with, but now I had to have it. I've psyched myself up for it, and now I feel really disappointed.
Yeah. After that moment, we went for Chinese with my in-laws.
Yeah.
And I sat there. I remember it being a round table. And I cried on the dinner table because it was like someone had sealed my fate. And then I did try and have a couple more conversations about, she's breech, but what are my options with a vaginal birth? And they said, well, it's been 12 years, the midwives are de-skilled, so we don't advise it. If I was right now carrying a breech baby, especially Frank breech, I would birth the shit out of that baby. I wouldn't even think twice.
Yeah.
But I was young, I was naive, I didn't know any better. They use terminology to scare you.
Coerce you, yeah.
And it wasn't until...
And it's a projection because they're scared. You might not be scared as the mum, but they are fearful.
It's only now that I realise, I can imagine the number of midwives that probably do end up doing an accidental percentage of breech or variations of birth, because babies also turn in labour. They also move around.
Yeah, of course.
And they're probably...
And people just turn up in labour. What do you do with them? People turn up, they're in labour, they're fully dilated and there's a bum there. What do? You do it.
I think the biggest thing was nobody ever said to me, it's just a variation of normal.
And don't get me wrong, there are risks involved. Yes, when you have a practitioner who isn't confident in something, that in itself is risky. But we need to remember it's the woman who's delivering. The midwife is just there to support. In all of my career, a woman has always pushed her own baby out, and I've just been there to essentially guide the baby out and to support the mother, especially when it comes to a frank breech. With any breech, there are different types of breech if it's a footling breech. Essentially in Annika's situation, it was the bum that was presenting, it was the bum that was in the pelvis. And so the legs, like baby was kind of folded like in half, right?
Yeah. Which, by the way, took a week for her legs
to come down. I'm sure it's hilarious. It's so funny when they're like that. There are times where you have like a breech where only one leg is in the cervix or in the pelvis, or both legs are in the pelvis. There are certain situations where you don't want to deliver that breech, because never mind what we want, you would tell the woman that the risk here is greater, because think about, for a head or a bum to come through, the largest diameter of a fetal head is about 9.5 centimetres. Therefore, your cervix gets to 10 centimetres in order to deliver your baby. For you to be fully dilated, it's 10 centimetres. A leg is nothing like that. So your baby isn't going to fall out, the head is not going to fall out and come earthside with a 2 centimetre cervix. But if you have a 2 centimetre cervix and there's only a leg there is a potential, or there's 2 legs there and we're only 4 centimetres.
Yeah.
There is a potential that you've now delivered the entire body, because the leg comes out, and where the body is softer, the body kind of fits through maybe. And then what do you do when it's a rigid head? The head's stuck there. So of course, and that's not coercion, that's genuinely a risk factor that people need to be aware of, that, the biology, that's where it's riskier to deliver a breech that isn't in the bum presenting first position. If you have a mother who's really adamant that she wants to deliver in breech or vaginally, and her baby is breech, and we're lucky enough to say, well, do you know what? We don't do it often. And if you're okay with that, we know the theory. We've got all the relevant people here. We know how to do it, but do we do it often? No. But we have the consultant present, we have the paediatricians here, and we will all be in the room to support you. The risks are X, Y, and Z. The percentage is A, B, and C. Your risk of a successful frank breech delivery is X. And if they say to you, I don't know the numbers off the top of my head, but if they say to you the chances of you delivering vaginally in frank breech is about, let's say, don't quote me, but let's say 86% or fucking 92%, you'll be like, that's a bloody high percentage.
Yeah.
That is a really high percentage. So at that point, you then think about your risk tolerance. Well, can I tolerate the 8% chance that it won't work? And if it doesn't work, then what do we do?
Yeah. And you know what? And that's that last bit that you just said. So where you're given a statistic, okay, even if you're like, I don't want to take that 8% chance.
Yeah.
But no one follows on with, if that 8% was to happen, this is what we would do. Nobody ever follows on.
What then happens? Because you ain't going to leave me there. You're not going to leave me there with half a baby
and
out.
your mind is going to go to the worst possible
Of course
scenario.
it is.
Or they will fearmonger and say, well, that 8% means that your baby's going to die.
And I've seen healthcare doctors, is in my experience, it's not me, I'm not slagging off doctors. I love doctors, but I have seen, I've been in rooms where the doctor comes in, does the talk, and then the woman will say, and what happens if not? And I've seen a doctor go, well, the fuck does well mean?
Yeah.
What does well mean? Well means nothing to me. Well, what? Well, I go home. Well, the baby comes out. Well, what, bro? Like, explain. And that's not informed consent. That's you feeding your own narrative for me to come down the path that you are more comfortable for me to come down. That's not fair. You need to tell me 92% chance of it being successful vaginally, 8% chance of it not. If it isn't, then we take you for an emergency section. Our threshold is low. Or if the baby is, let's say this happens, I mean, it could be really extreme. I'm not saying it's as simple as we just go for an emergency section. If you had a baby who, again, I'm not the obstetrician here, so if there was an obstetrician in the room, it would be great to confirm what I'm saying, but let's say in a really extreme scenario, there was a situation where the baby was too low down. Well, at this point now we have to push, it's riskier to now push the baby back up into the abdomen because the baby's made so much weight into the birth canal. It's actually risky to push the baby back up again. It's risky to you, to your pelvic floor, to your cervix, to the baby. And at that point now, we're not just looking at risk to the baby and to the mum. We're now looking at risks to organs. We're now looking at risks to the neonate, like to the fetus. When we push them back up, we're looking at all this kind of stuff. And so you might hear all of that and think, do you know what? I hear that it's 92%, but on the off chance that the 8% does happen, I'm not comfortable with all the rest of that happening. So actually I'm okay for us to go for a section. And then you'd go for your Chinese and maybe you wouldn't sit there crying because you would think, yeah, it's unfortunate, it's not what I wanted, but I'm really comfortable with the decision I made because I really am not happy with the 8% chance of something going wrong.
Yeah.
What a memorable Chinese. What did you order?
Tears.
Aww.
Tears on a plate.
Aww.
So after the C-section was confirmed, I guess a part of me was always hoping that would I go into labour naturally. I was really, really hoping that maybe that would be the case. And I lost my mucus plug at 37 weeks.
Okay.
And I was like I was excited because I was like, oh my God,
Maybe
like if this can happen vaginally, like my body wants to do this. And then I called is it triage?
Yeah.
And I was like, hey, I've lost my mucus plug, what do I do? And they were like, nothing, hold tight.
Yeah. Because
like,
mucus plug, you release it, it sits inside your cervix and you release it whenever there are changes. So as the cervix is softening, maybe dilating, coming forward, any kind of change, no matter how subtle, sometimes, not always, we lose our mucus plug. But the thing is, we regenerate this mucus plug also, which is why it feels like, my God, and I then lost it again on Tuesday, and then I lost it again on Friday, and you think, how much is coming? And that's why, because your body is, and that mucus plug is there to be able to prevent, it's like a protective barrier, protective mechanism to prevent any ascending infection, any infection going up from the vagina into the baby, into the uterus. And then there's like another backup mechanism where, like a fail-safe, where we've got the bag of waters. So the bag of waters is also protecting the baby, but it's all really clever. I think that in traditional antenatal classes, people are told, signs of labour are a mucus plug and a vomiting and diarrhea, and you think fucking mucus plug does fuck all. Like,
yeah.
it can be a sign. It can be something that, it can mean that things are happening. It means that your cervix is making changes. Does it mean that labour is round the corner? Probably not. And it might just be coincidental that you lose it and then you go into labour the next day, and then you get somebody who's like, I lost my mucus plug and the next day I went into labour. It's like, yeah, maybe because your cervix was just changing super fast. So it's a great sign that change is happening, that your body is getting ready, that cervix is changing. But is it a sign that labour is coming? No, not necessarily, which is why, to your point, triage told you to hold tight.
I feel like it was a cosmic joke by that point. Like everything that could happen for me to not have a vaginal birth, the bleeding, the low-lying placenta, the breach.
Yeah.
Oh my God. But I won't complain because everything that happened got me to where I am now. Like, it all plays a huge part.
Right.
Now, the next part of this is I had my baby via C-section, which, FYI, when I was in the operating room before they put the epidural in, I was sitting there and I was crying. I was like, I just want to go home. I just want to go home. And that can't have been easy for the anaesthetist as well. Like, I remember her. And they had to really calm me down just enough so that they could get that spinal in, lay me down. And that entire, for me, I know that a lot of women have C-sections and it's really like, it's a lovely experience for them. But for me, what that experience did was it disconnected me from my baby, because all of a sudden she's here and my body hadn't really gone through anything to get her there. I was completely numb. So it's just like, this baby is here, but this baby doesn't feel like mine.
That's so interesting.
Yeah. Then what happened is And
you didn't even feel like that even though you grew this baby. How interesting.
We went from the operating room to literally the recovery room right next door. And I could hear the next couple going in. It was literally like a...
turntable.
Yeah. I could hear the next couple going in. They were doing all the prep work, whatever. And I was there and I was trying to hold her. And I had this finger monitor on my finger and it was bugging me. Like, I couldn't hold her properly.
You and all the other women.
So I took it off and the nurse took my baby and said that I can't hold her unless I put the finger monitor back on. And that was the first time I felt like I'm not in control. Like first moment since my baby was born, because there were a lot of things that led up to it where I felt like I wasn't in control. Yeah. But that was the first time where it was just like, what it did is widen that disconnect. Like, I don't have any control over this. My baby can just so easily be taken away from me. Yeah. And if I don't listen, if I don't play by the rules, they can just take her away.
Which they can't. I hear what you're saying. That was what was going through your head, but I need to make it clear to you and to anyone who's watching. No, they can't. Unless there is an absolute safety reason, a safeguarding issue, a real concern. No one can take your baby away from you. That's not how it works. Just because you didn't have your blood pressure cuff on or your SATS probe on. No way. No way. Her job is important. Your recovery was important and it was necessary. Those findings are necessary. Your pulse, your oxygenation, all of that is needed in order to be able to safely transfer you. So it was in your best interest that it was in your best interest that she got the findings that she needed. However, what a difference it would have made had she said to you, Annika, because you're holding your baby, you'll notice that the probe keeps slipping off and so the machine keeps beeping and then I'm not able to get your pulse. Is there any other position that we can help you with so that you can hold baby or feed baby, depending on what you were doing, whilst having this probe on only for the next 30, 40, 50 minutes? Because once you've left recovery, this doesn't need to be on you. Or, Annika, this is because of the probe and the situation, this is what I'm using it for. Is there if you're not feeding baby for now, could we perhaps put baby skin to skin just for the time being? And then we'll get somebody to help with feeding after. Maybe a midwife can come and help with hand expressing instead. You might not go for them. You might say, nope. But at least the option was given to you. And at least you understand now why there's this importance behind this annoying thing on your finger. Which I'm sure at that point you'd be like, I understand. That's fine. I'll put baby skin to skin. You know? Because it's like what I said before. We're not stupid people. All we have to do is communicate with each other. And when you communicate to somebody the importance of your job and what it is that you're trying to do in order to keep that person safe, in the best interest of your patient, what person is going to say, no, bitch? No one is. They're going to look at you and be like, I'm so grateful. Thank you so much. I understand. Yeah. What can I do to make your job easier? You know? And I think, so all of that just comes down to a lack of communication. But in that moment, look at how it's made you feel. Yeah. Not in control, that my baby is not mine. After having left theatre feeling that to begin with, because your baby was lifted out of you. And it's so interesting because it sounds to me like you put so much value and worth into and meaning into physically pushing your baby out. It's almost like you told yourself, if you don't push your baby out, it was never yours to begin with. Like, in order for it to be yours, in order for this baby to be yours, for it to, the whole process to be complete, for it to mean anything, you put so much emphasis on that vaginal birth.
Yeah, which I think a lot of women do.
I think so too.
Yeah. Following on from that, I was adamant to leave the hospital as quickly as I could. I wanted that catheter out. I wanted to get moving. I remember in the night, they needed me to stay one night. That first morning, early hours, I did a wee in the little thing.
Yeah.
And I walked myself over holding it to show them that I
did. To prove it.
To prove it.
So that you could go.
Because the one I had done in the middle of the night...
You threw out.
I sent my husband to go and show them. And the lady, the midwife that was there, wasn't there in the morning.
Oh my God.
So I made sure that I delivered the goods.
Yeah. Here's my urine!
Yeah.
Send me home!
So then we got home and breastfeeding was difficult, but it wasn't, when I think about now, knowing everything that I know now, breastfeeding was a very simple fix. I had pain while I was feeding. It was a simple fix, but because...
If you had the right support.
Exactly. My milk didn't come in until midwife day 5, so us layman people day 6.
Yeah.
And the midwife came and she weighed baby. Baby had lost 11% body weight. Which, by the way, I want to caveat. This isn't information that people know, that if you've had a C-section, you most likely had IV fluids in your system, which means your baby's going to born a higher birth weight than they actually are, which means it's going to show a larger weight loss. Exactly. Yeah. Plus, my milk was delayed in coming in, probably because of the C-section, being a first-time mum, and probably partly because of the fluid build-up retention in the breast from the IV fluids. Yeah. So she lost weight. Midwife, she tried her best. Like, she was good. She tried her best to help me with breastfeeding, but the knowledge was limited. So she said the only option is express and give a bottle. Then once we went down that pathway, we used a terrible bottle which encouraged a shallow latch, and we were basically just jamming milk into her. Yeah. So she got used to the flow, blah, blah, blah. Yeah. So I exclusively pumped for 6 months. Now, my mental health got worse and worse and worse as each day would go by in my postpartum period. Yeah. I definitely had postpartum depression. I was so good at masking it. So when it came to my 6-week check and the health visitor, we had to go to this shady part of northwest London to the children's centre, and she asked me, she was like, how are you doing? And I was just like, yeah, I'm fine. Yeah. And that was it. Yeah. Nothing else. Yeah. Nothing else. It is so easy to pretend that you're okay, especially if no one's asking you specific questions. Yeah. So it got worse. The postpartum depression got worse, and then I was paranoid. I felt like everyone was trying to take my baby away. Like, I didn't want anyone to be around me. Why are they saying this? Why are they saying that? Like, it really spiraled into this postpartum psychosis, which, by the way, I didn't even know was a thing until about 2 years ago.
Not many people do. It's definitely not spoken about enough. And it really is spoken about at the very last point when somebody you know or you yourself are going through it. It is honestly so... I don't know why it's not spoken about enough, and I just think anything mental health-wise has this underlying tone of taboo. Has followed through from generations, and we're only now starting to kind of break out of that cycle, in my opinion, where people are now really open to talking about mental health, learning difficulties, ADHD, autism, anxiety, depression, all this kind of stuff, which the majority of people go through or are suffering with. Yeah. And postpartum psychosis is different to postpartum depression, and it's different to the baby blues. You're at higher risk of it if you've had a history of bipolar, schizophrenia, severe mental health history, and if there's no risk factors at all. No, you're not higher risk of it, but it doesn't mean that you cannot develop it, even if you have no risk factors at all. So it's really important, but the difference is that there's a lot of hallucinations involved, scary thoughts. Like, women will sit and tell you exactly what you said. You think people are out to get you. You think people are out to attack your baby or take your baby from you. And so, yeah, it's very dark, and it requires emergency medical treatment, like help, urgent help.
I couldn't rest, like I was just constantly like on edge, and I would sit in the living room with her next to me and just stare. Even putting the TV on was just...
How soon after you gave birth did this happen? Did you notice the first symptom?
I would say that day 6, when I had that, like I had a huge mental breakdown, and part of the reason why was because that midwife had spent so much time with me, longer than she anticipated. I can imagine her day would have had to really push on, because she really wanted to make sure I was okay. There's something in our culture called the chatti.
Yeah.
So it's a 6-day naming ceremony.
Oh yeah, I never knew it was called, but I know what that is.
Yeah.
Okay.
So traditionally, all the women, they come together, and it's said that at the stroke of midnight, one of the goddesses in the Hindu culture comes and writes your baby's future in red ink. But obviously it wasn't midnight, we did it during the day. We were living in a flat at the time, and the buzzer kept going off because the guests were arriving. So imagine she had spent like a good couple of hours with me by this point. So it really was her taking the time out.
Yeah.
And she was like, oh, how comes the buzzer keeps going off? And my husband went to go like see what was going on. And I burst into tears, and I was like, I didn't even want it. And she had no context.
Yeah.
She was like,
she thought you meant the baby.
She was like, Annika, you didn't want what? Like, you could see like her tone it shifted. Like, you could see she was like, okay, we need to figure out what's going on.
Yeah.
And I realised in that moment she thought I was talking about the baby.
Yeah.
So I was like, the chatti, like these people coming over. And then I very quickly had to shift my everything to make it seem like I was kept together. Because as soon as she said that, I was like, shit, like, I can't give anyone any chance of like taking away my baby, right? So I literally got my shit together in that split second. And the guests were really pushing in, like they really wanted to come in and whatever. So the midwife left, and all the women came in. And remember, it's a women-only event, but my dad came, which was really nice. He came. He was the only man there, like broke tradition by coming. And I remember literally just like breaking inside, because every single woman in that room has gone through what I have been through. They know how overwhelming it is to have 20, 30 people, you're 6 days postpartum, your milk's coming in, you're sore from being cut into. And I was just like, how can anyone stand here and just be okay with like what is going on? And I mentally broke. My dad was literally like, was there with like a hand on my shoulder, like he was just as if like, keep it together, like I'm here, keep it together, I'm here. And once they left, I don't think I was ever the same. I think it took me a long time. I don't think I'll ever be that person that I was. I've changed into someone different, someone stronger. But that moment it broke me.
Yeah.
So I'd probably say that's the moment where
it triggered. Yeah. And this is the thing with mental health, postpartum mental health, so many women just sit and suffer in silence.
I was so terrified that someone would take my baby away. Where I have had this fear for so long, like someone could take away my baby, like even the system, I think this is a worry that a lot of women have.
Huge. It's a huge worry. That if they tell me to supplement my baby with formula and I decide not to do it, they'll take my baby away. Or I'll get in trouble. When I started Mother off the back of like being so heavily inspired by my own mum. And that's not news to anyone. I talk about that all the time. But one thing I remember so well is that, and something I actually asked her again recently, because I was like, did I make this up in my head? I need to be sure before I share this. My mum gave birth to me, to my sister and I in Iran. And with everything that's going on in Iran, I think anyone who knew about Iran before knew that it was under a really strict regime. But now it's really in the media, and so people are starting to really see Iran, the government and the lifestyle maybe for what it is, right? And for what the government turned it into be. When it came to labour, my mum said it was really awful because they tied my hands to the bed. And I was like, Mum, I couldn't take her seriously because I was like, you're joking, right?
Yeah.
And she was like, no. She said, they tied me to the bed. They tied my arms to the sides of the bed. And I said, why would they do that? And she said, honestly, I don't know. because it's not like we were going anywhere, but I guess it was, and they did that to all the women. And so from her memory, she said there was about 3 or 4 of them in a room. She was in what sounded to be like established labour. She wasn't screaming because she was so worried. She described herself to be quite timid, like just wanted to be like really follow the rules type thing.
Yeah.
And she said, I didn't want to cause problems, so I was in agony. It was the worst pain I've ever felt, is what she said. And she said to me, and they tied my arms to the bed, and then because everybody else was screaming because they were contracting, the doctor then shouted at all of us and said, well, look at her. Be more like her. She's not screaming. And I thought, oh my God, there's so much wrong with this story. There is so much wrong with this story. And I said, but Mum, why did they tie her arms? She said, I think it was just to make their job easier so that we weren't like flying about or just causing havoc or like commotion, I guess. And I thought, my God. And it just makes me think that it's not just Iran, and it's not just tying hands to a bed. It's that in one country, it's the fact that they don't have clean water and safe healthcare. In another country, it's that you don't have anywhere to go. The furthest place the closest place you can go to for a hospital is, I don't know, maybe an hour's walk away, and they're not going to make it. In a country like mine, your hands are tied to your bed. I don't know if that still happens. I have no intel, but back then, this was 33 years ago now. And then in this country, okay, yeah, we don't tie your hands to the bed, and we give you clean water, and we put this, whole thing of like free healthcare, safe healthcare. But how safe is it when you can't speak up for yourself, or you don't feel empowered enough to speak up for yourself and ask the questions? That is what I want to know. My mum for me is such a symbol of that strength, and the person that so many of us have been at one point in our lives, where we have been silent, we've just conformed, we haven't really said anything, and we've kind of just not complained. The stoic. We've taken the pain and we've said, it is what it is. And that's not foreign to so many of us. Like, a lot of us have been in that position, whether we are immigrants or not, whether we are children of immigrants or not, or our parents are whoever we are. We've all been in that position, I believe, where we have felt like we shouldn't question this, or we're not going to, or this didn't feel right, but we did it anyway. And I guess Mother is then for all of those women. It's for the women who feel that everything was okay, but know deep down inside that something could have been different. And when they question, but how am I supposed to know? And that's why I say Mother knows best.